Good day everyone and welcome back to my channel. Today we'll be discussing about pneumonia. I would like to inform you all that World Pneumonia Day is celebrated on 12th of November every year. It has been started by WHO since 2009. This is about to bring awareness about pneumonia to all the children around here and also to tell you some aspects about prevention, treatment and protection against pneumonia. As you all know, pneumonia is an inflammation of the lung tissue. It is usually due to any infection. It is very important to know certain things about pneumonia today. This is broadly classified as a viral pneumonia or a bacterial pneumonia. We see very commonly both types of pneumonias, and sometimes these two types of pneumonias overlap each other. It is very difficult to differentiate between a viral pneumonia and a bacterial pneumonia. What are the symptoms of pneumonia? Cough is a common symptom. You may also have a high temperature. Other symptoms include loss of appetite, sweating, shivering, headache, and generalized body pains. All these symptoms are also seen in flu. We should differentiate between flu and pneumonia. Flu is the seasonal flu or the influenza, which is a viral respiratory tract infection. And it's very difficult to differentiate flu from pneumonia at a very early stages. Coughing, a lot of phlegm is more likely to happen in pneumonia than in flu. The phlegm generally becomes yellow colored or green colored, and sometimes it might be streaked with blood also. One can significantly cough out copious amounts of sputum and phlegm. Sometimes children can become short of breath. The breathing rate may become faster than normal, and they also develop a tight chest. Sometimes a sharp pain in the side of the chest may develop if the infection involves the chest wall or pleura, and sometimes fluid can also get accumulated in the pleura also. These symptoms are well appreciated when you visit a doctor. Now, when should you visit a doctor? If you have any symptoms like fever, wheezing, and headache which becomes worse, if you develop fast breathing, shortness of breath or chest pain, if you cough up a lot of phlegm associated with blood, or if the phlegm becomes rusty in color, and if the child is drowsy, lethargic, confused and not accepting feed well. Also, if you have recurrent episodes of pneumonia and any other symptoms that you should be concerned about, these should be immediate indications for you to take your child to the doctor for a good checkup. Now let us discuss about the causes of pneumonia. Pneumonia is commonly caused by an infection with an organism. It may be a virus or a bacteria. There are 3 to 4 different bacteria which are very common to cause pneumonia. There is also another group of bacteria that causes pneumonia in about 3 to 10 cases. They are called as atypicals. Other germs, that is fungi, yeasts and protozoa, can also cause pneumonia. Rarely, sometimes a non-infectious cause of pneumonia can be seen, especially in petroleum or kerosene ingestion. These chemicals form vapor and they go into the lung and cause chemical damage of the lung, which we call it as chemical pneumonitis. One may breathe in bacteria or virus or any other germs. If you are healthy, a small number of germs usually doesn't make any difference. But if your immune system is slightly on a weaker side, then these germs may rapidly multiply in the lung and cause a significant lung damage, which is called pneumonia. How do we diagnose pneumonia? A doctor will suspect pneumonia from asking you about your symptoms and how you are feeling. They may also take your medical history as well. The examination may include checking your temperature and a good examination of the chest. This is done by a stethoscope, and the chest will emit certain sounds that will be very much diagnostic for pneumonia. If any confusion arises, then the doctor might also ask blood investigations to know the intensity of infection and also a chest x-ray that would predict a damage of the lung. Chest x-ray is a very useful tool to confirm the diagnosis and to see how serious the infection is. Other tests may be also carried out if the child is sick. Now, what is the treatment of pneumonia? There are two types of treatment. One is a home treatment, one is a hospital treatment. Treatment may be done at home if the child is feeding well, not having any signs of dehydration, and not sick looking. An antibiotic is usually prescribed in cases where there is confusion about the cause of pneumonia, a viral or a bacterial. As we have discussed earlier that sometimes overlap of the symptoms might occur in both bacteria and virus. So generally an antibiotic is prescribed when a child comes with high-grade fever, severe cough and phlegm. Usually the first-line antibiotic is a penicillin derivative like amoxicillin, and once pneumonia is diagnosed, the best thing is to start an empirical antibiotic because these germs can be killed by an antibiotic. This amoxicillin is usually effective against the most common causes of pneumonia. And if by 48 to 72 hours, if the child's clinical condition worsens or if the parents don't see a reasonable improvement in the symptoms, it is always better to reconsult the doctor. And other general measures include lot of fluids, plenty of fluids to prevent dehydration, regular paracetamol to decrease the fevers, and let a doctor know if the symptoms do not improve within the next 48 to 72 hours. Adequate bed rest is very, very important. What about hospital treatment? If the child is not improving to conventional home treatment or if the child's clinical symptoms are worsening, that means the bacteria or virus which is responsible for the cause of pneumonia is damaging the lung. In this regard, hospital admission is a must if you have a severe pneumonia. In the hospital, usually based upon the clinical condition and the oxygen percentage in the blood, that is oxygen saturation, the doctor shall decide whether the child can be kept in the room to treat or in the ICU with oxygen. Now, after doing some investigations to finding out the intensity of pneumonia, then a suitable medication will be started along with supportive care. Fluids, respiratory care like oxygen, antibiotics, and if needed nebulizations with medication is recommended. Sometimes other supportive measures might fail. Oxygen and antibiotics might fail if the intensity of infection is more stronger than the medication that has been prescribed. In such scenarios, supportive breathing like a CPAP or a BiPAP, high flow nasal cannula, or sometimes even ventilating is also required. This is for the more serious outlook of pneumonia. If you are well enough to be looked after at home, your outcome is very good. 1 in around 100 pneumonias land up in the ICU, and out of which there is nearly 5 to 6% mortality also. If 100 patients are admitted with pneumonia in the ICU, there shall be 5 to 10% mortality. Please remember that even though pneumonia is very severe, can be aggressive sometimes, early intervention, early doctor consultation, and early intervention with antibiotic will cause a good reduction in the symptoms. Now, can pneumonia be prevented? Immunization against pneumonia, the most common cause is the bacterial pneumonia, and having an annual influenza viral shot are advised if you are at a greater risk of developing infections. But as a whole, nowadays Government of India is recommending vaccination against flu and pneumonia as well. So my dear friends, please take care. And during these times when we are under the influence of a pandemic, social distancing and mask and a good hand hygiene, recurrent use of hand sanitizer may greatly help in prevention of viral and bacterial respiratory tract infections. Thank you and stay safe.